These food allergy symptoms can fool you into thinking it's another illness, but ignoring them could cost your life. Have you ever experienced unexplained discomfort, a sudden itch, severe abdominal pain, or even shortness of breath after eating something without being able to figure out why? Or do you have a loved one who constantly struggles with seemingly unprovoked symptoms, has seen many doctors but still hasn't found the cause? In the complex world of human health, symptoms are not always straightforward. This is especially true for food allergies, a condition whose warning signs can mimic countless other illnesses, from the common cold irritable bowel syndrome (IBS) to psychological reactions like anxiety and panic attacks. This video is not just a typical guide. It's a detailed roadmap designed to help you navigate through the maze of symptoms, equipping you with the necessary knowledge to identify, differentiate, and act precisely. We will deeply explore each aspect, from the complex biological mechanisms of your body to specific real-life examples, helping you feel more confident in protecting your health and the health of your loved ones. Because when it comes to health, knowledge is power. Chapter 1. Understanding food. Allergies. Mechanisms and definitions. Before delving into specific symptoms, it's crucial to understand the nature of food allergies. A food allergy is not a mere discomfort, nor simply a picky eating habit, but a serious, potentially life-threatening immune reaction. To accurately recognize it, we need to clearly distinguish food allergies from other commonly confused concepts. 1.1. Food allergy versus food intolerance versus food sensitivity. These three concepts are often confused, but they have fundamental differences in the mechanism causing symptoms and the potential danger level. Food allergy. This is an immune system reaction. When a person has a food allergy, their immune system mistakenly identifies a harmless protein in food called an allergen as a dangerous threat to the body. To combat this invader, the immune system produces a specific type of antibody called immunoglobulin E, IgE. During the first exposure, these IgE antibodies attach to special immune cells called mast cells and basophils. When the allergenic food is eaten again, the allergenic proteins bind to the IgE antibodies on the surface of these cells, triggering a cascade of chemical reactions. These cells release powerful chemicals such as histamine, leukotrienes, and prostaglandins into the bloodstream and body tissues. These chemicals are precisely what cause acute allergic symptoms. This reaction typically occurs very quickly, often within minutes to 2 hours after eating, and even a very small amount of food can cause a severe reaction, even life-threatening anaphylaxis. A typical example is someone with a severe peanut allergy who could experience anaphylaxis just from a trace of peanut oil on their hand, accidentally touching their eye or mouth. Food intolerance. Unlike an allergy, food intolerance is a digestive system reaction not related to the immune system. It occurs when your body cannot effectively digest or process a specific substance in food. The most common reason is the deficiency of an enzyme needed to break down a certain component of the food. The classic and most common example is lactose intolerance, where the body lacks the enzyme lactase, which is necessary to break down lactose found in milk and dairy products. Without enough lactase, undigested lactose travels into the large intestine, where bacteria ferment it, causing uncomfortable symptoms. Food intolerance symptoms are usually milder, confined to the digestive tract, such as bloating, gas, abdominal cramps, nausea, diarrhea. Crucially, a larger amount of the food is often needed to cause symptoms, and it is never life-threatening. Someone with lactose intolerance might drink a little milk without issue, but a large glass could cause significant stomach discomfort. Food sensitivity. This is a less clearly defined concept within the mainstream medical community, and is sometimes controversial. This term is often used to describe reactions that are not IgE-mediated, like food allergies or specific enzyme deficiencies, like food intolerances, but still cause uncomfortable symptoms. These symptoms can include headaches, fatigue, brain fog, difficulty concentrating, joint pain, or skin issues like acne or eczema. The mechanism of food sensitivities is often more complex and not fully understood. Some theories suggest it may involve non-IgE-mediated immune responses, e.g., IgG antibody-mediated, although IgG tests are not recommended by major allergy organizations for diagnosis or other chronic inflammatory mechanisms in the body. Diagnosing food sensitivities is often difficult, and there is no standardized test. Typically, it relies on carefully controlled elimination diets under the guidance of a nutritionist or doctor to identify the culprit foods. For example, a person might feel tired or have a headache after eating certain grains or food additives without clear signs of an allergy or intolerance. The distinction between these three concepts is extremely important. Food allergies require extreme vigilance and emergency action plan, and often carrying emergency medication epinephrine, while intolerances and sensitivities can generally be managed by dietary adjustments without life-threatening risk. 1.2. The most common food allergens. Top 9 in the U.S. In the United States, the Food Allergen Labeling and Consumer Protection Act, FALCPA, requires food manufacturers to clearly label if their product contains any of the most common food allergens. Initially 8, this list expanded to 9 major allergens in 2023, often referred to as the Big 9. These foods cause the vast majority of serious allergic reactions and dominate diagnosed allergy cases. Milk. This is one of the most common food allergies in young children. Symptoms can include hives, vomiting, diarrhea, and in more severe cases, difficulty breathing. The good news is that most children, around 80%, will outgrow their milk allergy as they get older, usually by 3 to 5 years of age, or sometimes later. Eggs. Similar to milk, egg allergy is also very common in children. Reactions can range from mild hives to anaphylaxis. About 70% of children with egg allergies also have a good chance of outgrowing them by school age or adolescence. However, periodic reevaluation by an allergist is necessary. Peanuts. Peanut allergy is one of the most dangerous food allergies and often lasts a lifetime. Even a very small amount of peanuts can cause severe life-threatening reactions, anaphylaxis, including throat swelling, difficulty breathing, and a drop in blood pressure. It is one of the leading causes of food-induced anaphylaxis. Tree nuts. This group includes a wide variety of nuts such as almonds, walnuts, cashews, pecans, pistachios, macadamia nuts, Brazil nuts, and hazelnuts. Allergies to tree nuts are often lifelong and can cause severe reactions similar to peanut allergies. It's possible to be allergic to one or more types of nuts within this group. Wheat allergy is an IgE-mediated immune reaction to proteins in wheat. This is different from celiac disease, which is an autoimmune disease triggered by gluten, and also different from gluten intolerance. Wheat allergy symptoms can include hives, difficulty breathing, lip swelling, or digestive issues. Some children may outgrow a wheat allergy. Soy allergy is also common in young children and is often outgrown with age. Symptoms are usually milder, such as hives or stomach upset, but can cause more severe reactions in some cases. Fish allergy can occur with a specific type of fish, e.g., salmon, tuna, cod, or multiple types. This is usually a lifelong allergy and can cause severe reactions, including anaphylaxis, especially when exposed to steam from cooking fish. Shellfish. This group includes 2 main types: crustaceans like shrimp, crab, lobster, and mollusks like clams, mussels, oysters, squid, octopus. Crustacean allergy is more common and usually lifelong with a high risk of severe reactions. Mollusk allergy is less common but can also cause severe reactions. Sesame was the 9th major food allergen added to the U.S. Big 9 list in 2023 due to an increase in sesame allergy cases and the potential severity of reactions. Sesame is widely used in many foods and products, from bread and sauces to candies, making avoidance difficult. Symptoms can range from mild to severe. In addition to these, 900 of other foods can cause allergies, but those listed are the most common and responsible for the majority of severe reactions, warranting special attention. 1.3. Severity of allergic reactions. Allergic reactions can range from mild to extremely severe, even life-threatening. Recognizing the severity is crucial for timely and appropriate action. Mild reactions. Symptoms are usually localized and do not pose a direct threat to life. They may include oral itching or a slight tingling sensation around the lips, a few small localized hives, urticaria, or mild stomach discomfort like bloating or mild cramping. Although mild, these symptoms still need to be monitored as they can progress. Moderate reactions. Symptoms begin to spread more widely or cause more significant discomfort. This can include widespread hives over multiple body areas, swelling of the face, lips, eyelids, or tongue, angioedema, but without difficulty breathing. Digestive symptoms might be more severe, such as repeated vomiting or diarrhea. The person may start to experience mild wheezing or coughing. Although not immediately life-threatening, moderate reactions indicate a systemic response is occurring and require medical monitoring. Severe reactions anaphylaxis. This is the most serious and life-threatening systemic allergic reaction requiring immediate medical emergency care. Anaphylaxis occurs when there is a compromise in at least two organ systems, or when the cardiovascular or respiratory systems are dangerously involved. Symptoms can progress very rapidly and include respiratory system, severe difficulty breathing, wheezing, a whistling sound during exhalation due to narrowed airways, stridor, a high-pitched sound, due to upper airway obstruction, continuous coughing or throat constriction, causing a feeling of choking. Cardiovascular system, sudden drop in blood pressure which can cause dizziness, lightheadedness, fainting, rapid but weak pulse, pale or bluish skin due to poor circulation, feeling cold and clammy. Skin widespread hives across the entire body, generalized redness, flushing, significant angioedema in multiple areas, especially face, lips, tongue, throat. Digestive system, severe abdominal pain, intense cramping, nausea, continuous vomiting, uncontrolled diarrhea. Neurological system, extreme anxiety, restlessness, confusion, or a sense of impending doom, an alarming sign indicating the body is in severe distress. Anaphylaxis is a medical emergency. Epinephrine, EpiPen, AuVQ are auto-injectors containing epinephrine is the only medication that can stop anaphylaxis from progressing and save a person's life. Even if initial symptoms seem mild, if there are any signs of anaphylaxis, epinephrine must be administered immediately, and 911 or your local emergency number should be called, or the person should be taken to the nearest medical facility. With this foundational knowledge, we are now ready to delve into the most important part: how to differentiate allergic symptoms from countless other medical conditions. Chapter 2. Why are allergy symptoms so easily confused? The main reason why food allergies are often misdiagnosed or overlooked is that their symptoms are incredibly diverse and can overlap strikingly with many other health conditions. This complexity not only makes it difficult for patients, but sometimes also challenges healthcare professionals if they lack sufficient information or specialized allergy experience. 2.1. Overlap of body systems. Food allergies can affect multiple body systems simultaneously, or just a single system, making differentiation complex. Digestive system symptoms like nausea, vomiting, abdominal pain, and diarrhea are common reactions to allergens. However, these are also classic signs of many other conditions unrelated to allergies, such as food poisoning, due to bacteria, viruses, or toxins, stomach flu, acute viral gastroenteritis, irritable bowel syndrome, IBS with chronic bouts of diarrhea or constipation, inflammatory bowel diseases like Crohn's disease, or ulcerative colitis, or even physical manifestations of stress and anxiety. This overlap requires careful analysis of symptom onset, time, severity, and accompanying symptoms. Respiratory system. Difficulty breathing. Wheezing, coughing, nasal congestion, or runny nose are typical respiratory symptoms of allergies, but they are identical to symptoms of asthma, which allergies can trigger the common cold, flu, bronchitis, lower respiratory tract inflammation, or chronic sinusitis. Allergic wheezing often appears suddenly and rapidly, differing from the gradual wheezing of chronic asthma or infection. Skin hives, itching, and swelling are very common skin manifestations of food allergies. However, they are also similar to contact dermatitis, a skin reaction to an external irritant, not ingested food, eczema, atopic dermatitis, a chronic skin condition, heat rash, insect bites, drug reactions, or other skin diseases. The characteristics of food allergy rashes, such as rapidly migrating hives, are important distinguishing factors. Cardiovascular system. Dizziness, fainting, and low blood pressure are dangerous signs of anaphylaxis. However, they can also be confused with severe dehydration, hypoglycemia, low blood sugar, or underlying heart conditions unrelated to allergies. Lightheadedness, due to anxiety, can also cause confusion. 2.2. Timing and severity of reactions. The diverse timing of symptom onset is also a major source of confusion. Immediate reactions. IgE-mediated. Most IgE-mediated food allergy reactions occur very quickly, usually within minutes to 2 hours after eating the allergenic food. However, if the patient doesn't directly link the symptoms to the recent meal, e.g. snacking, then symptoms appear later, or not remembering clearly what they ate. They might easily think it's a sudden cold, an unexplained stomachache, or even a panic attack if respiratory or cardiovascular symptoms are prominent. Delayed reactions. Non-IgE mediated. Some types of allergic reactions, particularly non-IgE mediated reactions like food protein-induced enterocolitis syndrome. FPIEs can take several hours to several days to appear. Symptoms are usually confined to the digestive tract, severe vomiting, prolonged diarrhea, and make identifying the culprit food extremely difficult. This causes symptoms to be easily confused with chronic bowel diseases, gastrointestinal infections, or other digestive issues unrelated to allergies. 2.3. Lack of awareness and misinformation. Lack of specialized knowledge. Both the general public, and sometimes even healthcare professionals who are not allergy specialists, may lack in-depth knowledge about food allergies and how diversely they manifest. This leads to delayed diagnosis or missed crucial signs. Prevalence of fad diets. The explosion of healthy or elimination diets that cut out certain food groups like gluten, dairy without a medical diagnosis can further complicate the identification of true symptoms. Many people arbitrarily eliminate foods without allergy evidence, then attribute every discomfort to that food, distorting the actual diagnostic process. Misleading news and inaccurate information. On social media and the internet, information about food allergies is often mixed with unsubstantiated claims or unreliable diagnostic methods. This can lead people to self-diagnose incorrectly, miss serious signs, or pursue useless therapies. Understanding these challenges is the first step to overcoming them. Now we will get to the heart of the matter, analyzing each type of symptom and how to distinguish them from other conditions in detail. Chapter 3. Deep Symptom Analysis. Allergy or other illness. This is the most crucial part of the video, where we will delve into each symptom group, analyzing the unique characteristics of food allergies and comparing them in detail with other medical conditions that have similar symptoms. The goal is to provide you with the tools to differentiate and better understand what is happening in your body. 3.1. Digestive system symptoms. Digestive issues are among the most common manifestations of food allergies, but they are also the group of symptoms most easily confused. 3.1.1. Nausea and vomiting. Food allergy. When nausea and vomiting are symptoms of a food allergy, they typically occur suddenly within minutes to a maximum of 2 hours after eating the allergenic food. The severity of vomiting can range from mild to violent, and it often recurs within a short period. Importantly, these symptoms are usually not isolated. They tend to be accompanied by other allergic signs, particularly on the skin, such as rash, hives, swelling of the lips or face, or respiratory systems such as difficulty breathing, wheezing. For example, a child after eating a piece of cake containing milk to which they are allergic suddenly begins to vomit uncontrollably, and simultaneously itchy red welts, hives appear around their mouth and on their body. The simultaneous onset and rapid progression are key indicators. Confused with food poisoning. This is the most common cause of sudden nausea and vomiting. However, food poisoning is usually caused by bacteria like Salmonella E. coli, or their toxins or viruses. Onset time can range from several hours to several days after eating contaminated food, depending on the agent. Vomiting in food poisoning often comes with severe abdominal cramps, diarrhea often more frequent and potentially bloody or mucousy, and sometimes fever. The main difference is that food poisoning rarely causes skin or respiratory symptoms like allergies. Stomach flu, gastroenteritis, acute viral gastroenteritis, often caused by viruses rotavirus, norovirus. Symptoms include nausea, vomiting, diarrhea, abdominal pain, but usually accompanied by other systemic symptoms such as fever, muscle aches, fatigue, and chills. Unlike allergies, vomiting and diarrhea in stomach flu can last longer, several days, and are not directly related to a specific meal, but can be due to contagion from others. Gastroesophageal reflux disease. GERD. People with GERD may frequently feel nauseous or experience reflux, especially after large, greasy meals or when lying down. This is a chronic condition related to stomach acid, not an acute reaction to a specific food like an allergy. Symptoms can include heartburn, difficulty swallowing, and are not accompanied by other allergic symptoms like rash. Anxiety, stress, nausea can be a physical symptom of anxiety or a panic attack. When a person experiences extreme stress, the nervous system can affect the digestive system. However, anxiety-induced nausea is usually not accompanied by severe repetitive vomiting and other clear allergic symptoms, like hives, facial swelling, or difficulty breathing. Feelings of anxiety often precede or occur simultaneously with nausea. Key distinguishing point: very rapid onset after eating, acute severity of vomiting, and especially the presence of other allergic symptoms on the skin, rash, hives, or respiratory system difficulty breathing are strong indicators of a food allergy. If only nausea and vomiting are present without extra digestive allergic symptoms, other causes should be considered. 3.1.2 Abdominal pain and diarrhea. Food allergy. Abdominal pain due to an allergy is often severe cramping and sudden. Diarrhea can also be sudden and severe, often accompanied by nausea or vomiting. In some non-IgE-mediated allergic reactions, e.g. FPEs, food protein-induced enterocolitis syndrome, diarrhea can be prolonged, very severe, causing severe dehydration and sometimes containing blood or mucus. Onset is usually very rapid after eating or within a few hours for slower reactions. For example, an adult after eating a dish with shrimp hidden in the sauce suddenly experiences severe abdominal pain that makes them double over and begins to have uncontrolled diarrhea accompanied by a tingling sensation throughout their body. Confused with irritable bowel syndrome. IBS is a chronic condition causing abdominal pain, bloating, gas, and changes in bowel habits, diarrhea, constipation, or alternating both. IBS symptoms are often triggered by stress, certain specific foods, especially FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, or lifestyle changes. However, IBS is not an allergy and is not related to an IgE immune response. IBS symptoms are typically chronic, longer-lasting, and not sudden or acute like an allergic reaction. There are no accompanying hives, facial swelling, or difficulty breathing. Celiac disease. This is an autoimmune disease, not a food allergy, but an abnormal immune response to gluten, a protein found in wheat, barley, rye. When people with celiac disease eat gluten, their immune system attacks and damages the lining of the small intestine, causing symptoms like abdominal pain, bloating, chronic diarrhea, weight loss, fatigue, and anemia. Symptoms usually develop gradually after eating gluten and are a chronic condition differing from the acute reaction of a wheat allergy and IgE reaction. Inflammatory bowel disease (IBD), including Crohn's disease and ulcerative colitis. These are chronic autoimmune diseases that cause inflammation in the digestive tract. Symptoms include abdominal pain, diarrhea, often bloody, weight loss, fatigue, and sometimes fever. Diagnosis often requires endoscopy and biopsy. IBD is a chronic disease, not an acute reaction to a specific meal. Food intolerance, e.g., lactose. As explained above, food intolerance causes digestive symptoms, bloating, cramps, diarrhea, after consuming a large amount of a specific food. However, it does not cause an IgE immune reaction, therefore no hives, swelling, or difficulty breathing. Key distinguishing point: rapid onset, acute severity of abdominal pain and diarrhea, especially if accompanied by extra digestive symptoms like skin rash, swelling, or respiratory issues, are strong indicators of a food allergy. In the case of FPIs, although the reaction is slower, the severity of vomiting and diarrhea is often severe enough to cause dehydration and shock. 3.1.3 Itchy, burning, or swelling. Mouth, throat, oral allergy syndrome, OAS. Food allergy OAS, also known as pollen food syndrome, is a mild and localized form of allergic reaction. It occurs in individuals who already have pollen allergies, e.g., birch pollen, ragweed. When these individuals eat certain raw fruits, vegetables, or nuts that contain proteins similar to the proteins in the pollen, they are allergic to, their immune system reacts. Symptoms are typically itching, burning, or slight swelling in the lips, mouth, tongue, or throat immediately after eating the food. Symptoms are usually mild, temporary, and disappear quickly once the food is swallowed or leaves the mouth. For example, someone with a birch pollen allergy bites into a fresh apple and immediately feels a tingling itch in their mouth and throat. Cooking the food often denatures the allergenic proteins, making them safer to consume. Confused with severe systemic allergic reaction. While OAS is usually mild in rare cases, especially if the food is eaten in large quantities or is a true tree nut allergen, e.g., some people with OAS to hazelnuts can have more severe reactions. OAS can progress to systemic symptoms or anaphylaxis. It's crucial to recognize if symptoms spread beyond the mouth or throat. Normal irritation. Some highly acidic foods like lemon, pineapple, tomato, or spicy foods, chili peppers, can cause mild irritation or a burning sensation in the mouth and throat, but without itching, swelling, or flushing. This is due to the chemical nature of the food, not an immune reaction. Key distinguishing point: OAS is characterized by its association with pollen allergies, symptoms limited to the mouth, throat, or very mild and usually not severe, unless there are signs of systemic progression. If there are symptoms outside the mouth, rash, difficulty breathing, vomiting, it is not OAS but a more serious systemic allergic reaction. 3.2. Skin symptoms. Skin reactions are among the most recognizable signs of food allergies, but they can also be confused with many other dermatological conditions. 3.2.1. Hives, urticaria, and angioedema. Food allergy. Hives are red, swollen, intensely itchy welts that can appear anywhere on the body: face, neck, torso, limbs. A distinctive characteristic of allergy-induced hives is that they often migrate. A welt may appear in one spot, disappear after a few hours, then reappear in another location. They appear very rapidly, usually within minutes to an hour after eating the allergenic food. Angioedema is swelling beneath the skin, often in areas with loose tissue such as the lips, eyelids, tongue, throat, or face. Unlike hives, angioedema usually isn't very itchy, but causes a feeling of tightness, discomfort, and sometimes pain. Swelling of the throat and tongue is an extremely alarming sign, as it can cause airway obstruction. Both hives and angioedema are often the first signs of an IgE-mediated allergic reaction. For example, a child after eating ice cream containing peanuts to which they are allergic quickly develops facial and lip swelling accompanied by itchy red welts all over their body, appearing and disappearing in different locations. Confused with contact dermatitis. This is an inflammatory skin reaction that occurs when the skin comes into direct contact with an irritating or allergenic substance, e.g. poison, ivy, nickel in jewelry, chemicals in soap, perfume, or latex. The rash in contact dermatitis is usually red, itchy, and may have small blisters, but it only appears on the skin directly exposed to the agent. Unlike food allergies, contact dermatitis is not related to ingestion, and usually takes several hours to several days to appear after exposure. Eczema, atopic dermatitis. Eczema is a chronic skin condition characterized by dry, intensely itchy, red, scaly skin, sometimes with weeping or crusting. It often appears in the creases of the elbows, knees, neck, and face. While food allergies can exacerbate eczema in some individuals, especially young children, eczema itself is a chronic condition, not an acute allergic reaction to a specific meal. Drug reactions. Rashes, hives, and angioedema can be side effects or allergic reactions to certain medications. It is important to consider the patient's recent medication history for differentiation. Viral rashes. Viral infections like measles, rubella, chickenpox, or hand, foot, and mouth disease cause characteristic rashes. However, these rashes are usually accompanied by fever, general fatigue, and have distinct morphologies and locations unlike hives. Chronic, idiopathic urticaria. Some people develop hives with no clear cause, idiopathic, or hives lasting longer than 6 weeks, chronic. In these cases, the hives are not related to a specific food, but are a chronic condition of the immune system, often requiring long-term medication management. Key distinguishing point. Extremely rapid onset after eating within minutes to an hour. The migratory nature of hives appearing and disappearing in different locations, and especially the combination with symptoms in the respiratory system. Difficulty breathing, coughing, or digestive system vomiting. Diarrhea are strong indicators of a food allergy. 3.2.2. Facial body flushing. Food allergy. The skin becomes red with a sensation of heat, often a sign of widespread histamine release in the body. This can occur on the face, neck, chest, or entire body. Flushing can accompany hives and angioedema, and is part of a systemic allergic reaction, especially anaphylaxis. For example, a person suddenly flushes in the face, ears, and neck after eating seafood, accompanied by a sensation of warmth and mild difficulty breathing. Confused with alcohol reaction. Many people, especially those of East Asian descent, due to a gene variant causing a deficiency in the enzyme that metabolizes acetaldehyde. A byproduct of alcohol will experience facial redness, nausea, and a rapid heartbeat after drinking alcohol. This is a metabolic reaction, not an allergy. Carcinoid syndrome. This is a rare condition caused by neuroendocrine tumors that produce excessive hormones like serotonin. The main symptoms are episodes of facial and neck flushing, often accompanied by diarrhea and wheezing. Menopause. Hot flashes are common symptoms in women during menopause, causing a sudden sensation of warmth and redness of the face and neck. Drug reactions. Some medications, such as niacin vitamin B3 or certain blood pressure medications, can cause facial and skin flushing as a side effect. Key distinguishing point: flushing, due to a food allergy, usually occurs suddenly, is directly linked to the consumption of a specific food, and is accompanied by other allergic symptoms, such as hive swelling or difficulty breathing. If only flushing is present without other symptoms, other causes should be considered. 3.3. Respiratory system. Symptoms. Respiratory symptoms from food allergies can range from mild to extremely dangerous, and differentiating them from common respiratory illnesses is crucial. 3.3.1. Wheezing difficulty, breathing, coughing food allergy. When a food allergy causes lower respiratory symptoms, it's due to the constriction of the airways, bronchi causing a whistling sound during breathing, wheezing. A feeling of shortness of breath, gasping for air, and continuous coughing, often dry or severe. Onset is very rapid, usually within minutes after eating. This is a serious symptom, especially a clear sign of anaphylaxis. For example, a child after accidentally swallowing a small piece of cookie containing egg suddenly begins to cough violently and uncontrollably, gasping for breath, and a distinct wheezing sound is audible, indicating airway narrowing. Confused with asthma, asthma also causes wheezing and difficulty breathing due to inflamed and constricted airways. However, asthma attacks usually have other triggers such as cold air, strenuous exercise, pollen, pet dander, or smoke, dust. It's important to note that food allergies can cause acute asthma attacks or worsen asthma in individuals with a history of the condition. If someone with asthma experiences a sudden severe attack after eating a food allergy, should be considered. Cold flu. Cause coughing and mild difficulty breathing, often due to nasal congestion or sore throat, but usually accompanied by fever, sore throat, thick nasal discharge, body aches, and general fatigue. Onset is slower and symptoms develop gradually. Bronchitis. This is an inflammation of the large air passages in the lungs, causing a prolonged cough, potentially with phlegm and chest tightness. It's usually caused by viral or bacterial infections or irritation from smoke. There's no sudden onset after eating or other allergic symptoms. Panic attack, anxiety. Causes rapid breathing, shortness of breath, hyperventilation, and a feeling of choking. However, there is no true wheezing or physical airway constriction. Symptoms are often accompanied by extreme anxiety, rapid heartbeat due to psychological factors, and no allergic skin or digestive signs. Choking on a foreign object. Sudden difficulty breathing after eating, but without other allergic symptoms. The person usually shows signs of choking, inability to speak, or weak cough. Key distinguishing point. Sudden and rapidly worsening onset after eating, not accompanied by fever or typical cold flu symptoms, and especially the presence of other allergic symptoms on the skin or digestive tract, are strong indicators of a food allergy causing respiratory reactions. 3.3.2. Nasal congestion. Runny nose. Sneezing, allergic rhinitis. Food allergy. These symptoms can include nasal itching, clear runny nose, continuous sneezing in bouts, and nasal congestion. It may also be accompanied by itchy, red, watery eyes. Often appears after exposure to the allergenic food. This is generally a milder form of allergic reaction, rarely life-threatening, unless it progresses to more severe respiratory symptoms like difficulty breathing. For example, a person eats a type of nut they are sensitive or mildly allergic to, and then begins to sneeze continuously and have a runny nose accompanied by itchy eyes. Confused with common cold causes nasal congestion, runny nose, sneezing, but usually accompanied by sore throat, cough, low-grade fever, and general fatigue. Nasal discharge can be thick and change color over time. Symptoms usually last several days. Sinusitis. Causes facial pain, pressure in the sinus areas, thick green-yellow nasal discharge, and possibly fever. Symptoms usually last longer than a cold. Non-allergic rhinitis. Vasomotor. Rhinitis causes symptoms similar to allergic rhinitis. Nasal congestion. Runny nose, sneezing, but is not due to an allergic reaction. Triggers can include changes in temperature, humidity, dust, strong chemical odors, or stress. Key distinguishing point. Allergic rhinitis symptoms due to food often occur very rapidly after eating, are not accompanied by fever or sore throat of a cold, and may be accompanied by itchy eyes or other allergic skin symptoms like facial itching. 3.3.3. Hoarseness. Voice, change difficulty, swallowing, food allergy. Severe swelling of the vocal cords or throat, due to angioedema, can cause hoarseness. Voice changes often deeper or raspy, difficulty speaking. A sensation of a lump in the throat, feeling of choking, or actual difficulty swallowing food and saliva are extremely dangerous signs. This is a direct sign that the airway is being obstructed, which can lead to respiratory failure. For example, a person after eating seafood suddenly experiences a raspy voice, difficulty speaking, and feels as if something is constricting their throat, making them unable to swallow. Confused with sore throat, tonsillitis, causes sore throat, difficulty swallowing, but usually accompanied by fever, swollen lymph nodes in the neck, and typically no acute or clear swelling or difficulty breathing like an allergy. Onset is more gradual. Gastroesophageal reflux disease. GERD. Stomach acid. Refluxing into the throat can cause chronic hoarseness, especially in the morning, or a sensation of a lump in the throat, but it does not cause sudden, acute, dangerous difficulty swallowing like an allergy. Globus sensation. This is the feeling of a lump in the throat without any physical obstruction, often associated with anxiety, stress, or mild reflux. There is no physical swelling or difficulty breathing. Key distinguishing point. Sudden onset, rapidly worsening, and often accompanied by other systemic symptoms of anaphylaxis such as hives. Difficulty breathing, low blood pressure are urgent warning signs. Immediate emergency medical attention is required. 3.4. Cardiovascular and systemic symptoms, signs of anaphylaxis. These symptoms are often signs of the most severe systemic reaction, anaphylaxis, and require immediate emergency medical intervention. 3.4.1. Dizziness, lightheadedness, fainting, food allergy. These symptoms occur due to a sudden and severe drop in blood pressure caused by a systemic allergic reaction that dilates blood vessels and causes fluid to leak out of them. The person may feel dizzy, lightheaded, faint, weak, and in severe cases may faint or lose consciousness. This is a dangerous sign of anaphylaxis, indicating that the circulatory system is failing. For example, someone with a cashew allergy, after accidentally eating a dish containing cashews, suddenly feels their head spinning, can't stand steadily, and nearly collapses. Confused with dehydration, hypoglycemia. Severe dehydration, or low blood sugar, hypoglycemia, can also cause dizziness, fatigue, weakness, and sometimes fainting. However, these symptoms are usually related to insufficient food or fluid intake, strenuous physical activity, or in diabetic patients. They are not accompanied by sudden rash or throat swelling. Orthostatic hypotension. Dizziness occurs when standing up too quickly from a sitting or lying position due to blood pressure not adjusting quickly enough. This symptom is usually transient and not as severe as blood pressure drop due to anaphylaxis. Anemia. Severe anemia can cause chronic fatigue, dizziness, paleness. But this is a condition that develops gradually, not acutely, after eating. Stroke causes. Sudden dizziness, loss of balance, but often accompanied by localized neurological signs, such as weakness on one side of the body, difficulty speaking, facial drooping, or double vision. Anxiety, panic attack. A panic attack can cause feelings of lightheadedness and palpitations, but usually without an actual drop in blood pressure, although the sensation can be very similar. There are no other severe physical signs of allergy. Key distinguishing point. Dizziness or fainting. Due to a food allergy, has a sudden onset after eating, and most importantly is usually accompanied by other allergic symptoms in other organ systems such as rash, throat swelling, difficulty breathing, or digestive issues. 3.4.2. pale skin, bluish lips. Food allergy. This is a sign of severe reduction in blood circulation to peripheral tissues due to anaphylaxis. The skin can become pale cold and clammy cold sweat. Lips and fingernails can turn bluish cyanotic due to lack of oxygen. These are signs of shock requiring emergency care. Confused with shock from other causes. Shock due to blood loss. Septic shock. Cardiogenic shock also cause similar symptoms. Pale cold, clammy skin. Cold. Simply due to the body being cold in a low-temperature environment. Key distinguishing point occurs together with other allergic symptoms such as low blood pressure, difficulty breathing, widespread hives after exposure to the allergenic food. 3.4.3. Weak and rapid pulse food allergy. In anaphylaxis, as blood pressure drops, the body tries to compensate by increasing heart rate to maintain blood flow to vital organs. Therefore, the pulse becomes rapid high heart rate, but weak, difficult to feel, indicating the heart is working excessively, but ineffectively, at pumping blood. This is a critical sign of anaphylaxis. Confused with dehydration. Severe dehydration can increase heart rate, but usually does not cause a pulse as weak as in shock. Fever, infection. High fever or severe infection can increase heart rate to cope with inflammation. Anxiety. An anxiety or panic attack can cause a rapid heart rate palpitations, but typically does not cause a weak pulse. Key distinguishing point. The combination of a rapid and weak pulse with low blood pressure, rash, difficulty breathing, and other systemic symptoms is a clear indicator of anaphylaxis. 3.4.4. Sense of impending doom, food allergy. This is a feeling of extreme, inexplicable dread or uneasiness and can be one of the earliest symptoms of anaphylaxis. The body may sense an imminent system collapse even before the most obvious physical symptoms. This feeling is often accompanied by other rapidly progressing physical symptoms. Confused with panic attack, severe anxiety. Although a panic attack also causes extreme fear and can make the person believe they are dying, it usually does not involve severe physical signs like throat swelling, true wheezing, airway constriction, or objective low blood pressure. Key distinguishing point. A sense of impending doom combined with developing dangerous physical signs such as difficulty breathing, hives, swelling, low blood pressure indicates anaphylaxis, not just a purely psychological issue. This is a red flag requiring immediate action. 3.5. Other and less common symptoms. Some other symptoms are less common or are generally not primary signs of IgE-mediated food allergies. 3.5.1. Headaches, migraines. Food allergy. While some people claim food allergies can cause headaches or migraines, this is typically not a characteristic symptom of acute IgE-mediated food allergies. However, in cases of food sensitivities, not true allergies or intolerances, some people may report headaches or migraines as a symptom. For example, migraines can be triggered by food additives like monosodium glutamate, MSG, or sulfites, but these are chemical or physiological reactions, not immune allergies. Confused with headaches have diverse causes: stress, lack of sleep, dehydration, eye strain, sinusitis, hormonal changes, history of head injury, or other neurological conditions. Migraines have their own specific characteristics, often one-sided pain, sensitivity to light and sound, nausea. Key distinguishing point. If a headache is the sole or primary symptom and is not accompanied by any other acute allergic symptoms like rash, swelling, difficulty breathing, it is highly unlikely to be a food allergy. More common causes of headaches should be considered. 3.5.2. Fatigue, difficulty. Concentrating, brain fog, food allergy. These symptoms are generally not acute manifestations of IgE-mediated food allergies. However, in individuals with poorly controlled chronic allergies or food sensitivities, especially non-IgE-mediated reactions causing chronic inflammation, continuous inflammation, or immune system stress, can cause chronic fatigue, difficulty concentrating, and a brain fog sensation. This is often the result of a prolonged process, rather than an acute reaction. Confused with lack of sleep, chronic psychological stress, malnutrition, anemia, chronic diseases such as hypothyroidism, chronic fatigue syndrome, rheumatoid arthritis, depression, anxiety, or neurological conditions. Key distinguishing point. These are chronic symptoms, not acute ones, appearing immediately after eating. and require a more comprehensive diagnosis from various medical specialties, not just allergy. If you experience these symptoms, seek medical advice to determine the root cause. The in-depth analysis of each symptom type clearly shows that recognizing a food allergy is not just about looking at a single sign, but about a comprehensive assessment of symptoms, their onset time, and especially the repeated and consistent link to eating a specific food. Chapter 4: Common Diagnostic Mistakes and When to Act Urgently. Given the complexity and diversity of food allergy symptoms, it's not surprising that this is one of the most commonly misdiagnosed or overlooked health conditions. Recognizing these mistakes and understanding when to act urgently is paramount to protecting lives. 4.1. Common Diagnostic Mistakes. Doctors, patients, and even family members can make common errors when trying to decipher allergy-like symptoms. 4.1.1. Confusion with anxiety, panic attack. Problem: anaphylaxis. Symptoms such as difficulty breathing, feeling of choking, rapid heartbeat, dizziness, and extreme fear can be very similar to a panic attack or a severe anxiety episode. In an emergency, both the patient and those around them might focus on the psychological aspect, dismissing it as just anxiety. Consequence: missing a diagnosis of severe food allergy, especially anaphylaxis, can lead to delayed treatment. While anxiety needs attention, anaphylaxis is a medical emergency requiring immediate medication to save a person's life. Delay can be life-threatening. How to avoid: always consider the person's recent eating history. If there are any other objective physical signs not related to anxiety, such as hives, lip, face, throat swelling, clear wheezing, or measurable low blood pressure, prioritize treating it as an allergic emergency. In case of doubt, always act as if it is the most serious case. 4.1.2. Dismissing digestive symptoms. Problem: abdominal pain. Nausea, vomiting, and diarrhea are very common symptoms, often dismissed as sensitive stomach, food disagreement, or mild food poisoning, and not fully reported to a doctor. Even doctors may initially attribute them to common digestive causes. Consequence: dismissing digestive symptoms can overlook non-IgE-mediated food allergies like FPIEs, which can cause severe vomiting and diarrhea leading to dehydration and shock. It can also overlook other forms of delayed allergic reactions or food sensitivities that significantly impact quality of life. How to avoid: always record digestive symptoms in detail, including onset time and foods eaten. If symptoms recur after eating a specific food, or if they are very severe, seek evaluation from an allergist. 4.1.3. Self-diagnosing or relying on unreliable tests. Problem: the explosion of information on the internet has led to the proliferation of scientifically unproven food sensitivity tests, e.g. IgG tests, hair analysis, cytotoxic testing, kinesiology. These tests are often inaccurate, yielding false positives for many foods, and are not recommended by major allergy organizations worldwide. Based on these results, many people arbitrarily eliminate numerous foods from their diet without medical indication. Consequence: misdiagnosis leads to unnecessary dietary restrictions, complicating daily life, and more importantly, can lead to serious nutritional deficiencies, especially in children. Furthermore, eliminating too many foods can mask the true symptoms of allergies or other health problems, distorting the accurate medical diagnostic process and missing actual conditions that require treatment. How to avoid: always consult with a licensed allergist. They are trained professionals who can accurately diagnose food allergies based on scientifically proven methods. 4.2. When to seek emergency medical help. Call 911 emergency immediately. This is the most critical part and needs to be emphasized repeatedly. Recognizing and acting quickly when there are signs of anaphylaxis can save a life. Anaphylaxis is a medical emergency. If you or someone you know shows any of the following signs after eating a suspected food, call 911 or your local emergency number immediately. Difficulty breathing, wheezing, whistling sound during exhalation, stridor, high-pitched sound from upper airway obstruction. These are signs that the airway is narrowing or obstructed, may be accompanied by continuous coughing, gasping, or a feeling of choking. Swelling of the throat, lips, tongue, or face, especially rapid swelling. Swelling in these areas can quickly obstruct the airway and become life-threatening. Difficulty swallowing or a choking sensation in the throat. An unusual feeling in the throat like a lump or difficulty swallowing saliva is a sign of progressing throat swelling. Dizziness, lightheadedness, fainting. This is a sign of a severe drop in blood pressure, leading to insufficient blood flow to the brain. The person may feel weak, unsteady, and lose consciousness. Weak and rapid pulse. The heart beats fast to try and pump blood to compensate for low blood pressure, but the pulse is weak due to insufficient blood volume in circulation. Widespread hives, generalized flushing, and intense itching. While hives can be a mild symptom if they spread rapidly across the entire body, accompanied by flushing and uncontrollable itching, especially if combined with other symptoms, respiratory, digestive, cardiovascular. This is a sign of a systemic reaction. Severe abdominal pain, uncontrolled vomiting, or diarrhea. Digestive symptoms can be very severe in anaphylaxis, causing rapid dehydration and shock. Sense of impending doom. A feeling of extreme anxiety, inexplicable dread, can be an early sign that the body's vital functions are severely compromised. Do not hesitate. Call 911 immediately. If the person has been prescribed an epinephrine autoinjector, e.g. EpiPen AVQ, injected immediately into the outer thigh, and still call 911. Epinephrine is the only medication that can reverse anaphylaxis and save a life. Even if the person feels better after using EpiPen, they still need to be taken to the emergency room for monitoring as symptoms can recur. Biphasic reaction. Always prioritize safety. Early recognition and rapid action can save lives. Nothing is more important than protecting your safety and that of those around you. Chapter 5. Accurate diagnosis. Process and allergy management. When a food allergy is suspected, taking the right approach and following a professional diagnostic process is key to an accurate diagnosis and an effective management plan. 5.1. Food and symptom diary. This is the first and most crucial step you can take yourself when suspecting a food allergy. A detailed diary will provide invaluable information to your allergist. Record everything you eat and drink. Be as detailed as possible, including ingredients. If known, especially hidden ingredients like oils, sauces, brand names, and preparation methods. Time of consumption. Record the exact time you consumed the food. Symptoms experienced. Describe specific symptoms you experienced, e.g., hives on neck and chest, severe itching, severe abdominal cramps and vomited 3 times, mild shortness of breath and dry cough. Time of symptom onset. Record the exact time from consumption to when symptoms began. Severity of symptoms. Rate the severity from mild, moderate to severe. Duration of symptoms. How long did symptoms last? Did they resolve on their own or require medication? Any medication used. Record medications you took, e.g. antihistamines, pain relievers, and their effectiveness. Other activities. Record any activities you performed before or after eating, e.g. exercise, hot shower, pollen exposure, as sometimes they can be cofactors for allergic reactions. This diary will help your allergist connect foods to symptoms, allowing them to form initial hypotheses about the cause of the allergy. 5.2. Expert consultation. Allergist, immunologist. Once you have your symptom diary, the next step is to consult an allergist/immunologist. This is the only specialist who can accurately diagnose food allergies and provide an appropriate management plan. Do not self-diagnose or rely on unofficial information online. What they will do: detailed medical history. The doctor will thoroughly ask about your personal and family allergy history, including asthma, eczema, allergic rhinitis, your specific symptoms based on your diary time of onset, severity, and potential triggers. Physical examination. The doctor will conduct a general physical exam to assess your current condition and look for physical signs of allergy. 5.3. Reliable diagnostic methods. After collecting medical history and conducting a physical examination, the allergist will recommend appropriate tests. 5.3. 1. Skin prick test, SPT. How it's done. This is a quick and common test. A very small amount of potential allergenic food extract is placed on your skin, usually the forearm or back. Then the doctor uses a small, sterile, sharp lancet to gently prick through the top layer of skin at the site of the extract. This process does not cause bleeding and is minimally painful. Results: if you are allergic to that food, your immune system will react by releasing histamine locally. Within 15-20 minutes, a red, swollen, itchy bump like a mosquito bite will appear at the prick site, surrounded by a red flare. The size of the wheal often correlates with the degree of sensitivity. Advantages: quick, immediate results, minimally invasive. Limitations: can have false positives, positive result, but no clinical symptoms when eating the food, or false negatives, negative result, but you may still be allergic. SPT only detects IgE-mediated allergies and does not diagnose non-IgE-mediated allergies or food intolerances. Antihistamines need to be stopped several days before the test, as they can suppress the reaction and cause false negative results. 5.3.2 Blood test. Specific IgE blood test, RAS test, immunocap. How it's done: a blood sample will be taken from your vein. This blood sample is then sent to a lab to measure the amount of specific IgE antibodies against each suspected food protein. High levels of IgE for a specific food may indicate an allergy. Advantages: not affected by antihistamine use, can be performed on individuals with skin conditions unsuitable for skin prick testing, like severe eczema or those at risk of severe reactions to SPT. Safer for suspected severe anaphylaxis cases. Limitations: similar to SPT, blood tests can also have false positives or false negatives. The result only indicates immune system sensitization, not the severity of the clinical reaction you will experience. Results usually take several days to weeks. 5.3.3 Oral Food Challenge, OFC. This is considered the gold standard for diagnosing food allergies. OFC is performed to definitively determine whether a person is allergic to a specific food, or to determine if a person has outgrown an allergy common in young children with milk and eggs. How it's done: OFC must be performed under strict supervision of an allergist in a safe medical environment, with full emergency equipment and medications including epinephrine. The patient will be given a very small amount of the suspected food, and then this amount will be gradually increased at specific intervals, e.g., every 15-20 minutes, while vital signs, blood pressure, heart rate, breathing rate, and symptoms are carefully monitored. If no reaction occurs after consuming a certain amount, the patient will be considered not allergic to that food. If a reaction occurs, the challenge will be stopped and symptoms will be treated. Advantages: provides the most accurate answer regarding the presence or absence of an allergy and the reaction threshold. This is the only way to confirm a diagnosis or determine if tolerance has developed. Limitations: carries a risk of causing severe allergic reactions, including anaphylaxis, so it must be performed in a safe medical environment with experienced medical personnel. 5.4 Unreliable methods to avoid. Unfortunately, there are many food allergy diagnostic methods that lack scientific basis and can be harmful. IgG testing. As mentioned, IgG testing is not recommended by major allergy organizations such as AAAI, EAACI for diagnosing food allergies. High levels of IgG antibodies simply indicate that you have been exposed to that food in the past, not a sign of an allergic reaction or clinical sensitivity. Hair analysis, kinesiology, cytotoxic testing, electrodermal testing, Vega testing, bioresonance testing, etc. All of these methods lack scientific evidence and are not accepted in modern medicine for diagnosing food allergies. They can lead to misdiagnosis, unnecessary food elimination, and delay in seeking appropriate medical care. 5.5 Food allergy management, living with allergies. Once an accurate diagnosis is made, allergy management is key to living a healthy and safe life. This is an ongoing process that requires vigilance and discipline. 5.5.1 Avoiding allergenic foods. Read food labels carefully. In the US, FALCPA requires manufacturers to clearly label the big 9 allergens on product labels. Learn to recognize terms related to allergens and always check labels even for familiar products, as formulas can change at any time. Always look for contains or may contain statements and cross-contamination warnings. Be vigilant about cross-contamination. This is one of the biggest risks. Cross-contamination occurs when a very small amount of allergenic protein from one food transfers to another. For example, using the same utensils, cutting board or cooking oil for allergenic and safe foods. In the kitchen, ensure separate cleaning of utensils and preparation surfaces. Avoid bakeries or ice cream shops that don't have clear procedures to prevent cross-contamination. Eating out. Always clearly inform restaurant staff, chefs, or managers about your allergies. Don't hesitate to ask about ingredients and preparation processes. Research restaurants thoroughly beforehand, check online menus and reviews from people with allergies. At home, establish a safe zone for the allergic individual. Use separate utensils, cutting boards, and dishes if necessary. Ensure all family members understand the allergy and how to avoid cross-contamination. 5.5.2. Always carry an epinephrine auto-injector if prescribed. This is a lifesaver in case of anaphylaxis. Always carry at least 2 epinephrine auto-injectors, e.g., EpiPen AVQ, with you at all times. Instructions for use. Learn how to use it correctly, usually inject it into the outer thigh, and instruct family members, friends, colleagues, and teachers, if a child, on how to use it and when to use it. Check the expiration date regularly. 5.5.3. Emergency Action Plan. A personalized document. Developed by your allergist, it clearly outlines your allergic symptom steps for managing each level of severity. When to use antihistamines, when to use EpiPen, when to call emergency services, and emergency contact information for your doctor and family. Provide copies of this plan to schools, daycares, workplaces, friends, extended family, or anyone who might be with you during a reaction. 5.5.4. Antihistamines. Only for mild symptoms, such as itching, mild localized hives, or runny nose. Never substitute epinephrine for anaphylaxis. Antihistamines are ineffective against low blood pressure or severe difficulty breathing. 5.5.5. Medical alert, bracelet, card. Carry it, wear a medical alert bracelet, or carry a card detailing your allergy status. This is crucial for informing medical personnel in an emergency if you are unable to speak for yourself. 5.5.6. Educate yourself and others. Continuous learning about your allergy, new research, and safe products. Raise awareness. Share knowledge about food allergies with your community to help those around you understand and support you. 5.5.7. Psychological support. Coping with anxiety. Living with food allergies can cause stress, anxiety, and limit social life. Seek support groups for people with allergies or psychological counseling if you feel mentally affected. Do not hesitate to seek help to manage the psychological aspect of allergies. Chapter 6. Special Cases and Future Prospects. Food allergy is a rapidly advancing field of research offering hope for those affected. 6.1. Food allergies in children and the potential to outgrow them. Many children with allergies to common foods like milk, eggs, wheat, and soy can outgrow their allergies as they get older. This is great news for families. Regular retesting. Your allergist may recommend periodic retesting, e.g. blood tests, or performing an oral food challenge, OFC, to see if the allergy has resolved. This is usually done according to a specific schedule prescribed by the doctor. Benefits. Determining that an allergy has resolved allows children to broaden their diet, avoid unnecessary restrictions, improve their quality of life, and reduce the burden on families. 6.2. Food allergies in adults. Food allergies are not just a childhood issue. They can develop at any age, even for the first time in adulthood. Common culprits. In adults, newly developed allergies are often to tree nuts, fish, shellfish, shrimp, crab, and sesame. Characteristics. Adult-onset allergies tend to be lifelong and can cause more severe reactions compared to allergies in children. 6.3. Future prospects in food allergy treatment. Science is making significant strides in treating food allergies, offering hope to millions. 6.3.1. Oral immunotherapy. OIT mechanism. OIT is an advanced treatment method where the patient is given a very small amount of allergenic protein daily, gradually increasing the dose over time for several months to several years under strict medical supervision. The goal of OIT is not to completely cure the allergy, but to increase the patient's reaction threshold. This means they can tolerate small amounts of accidental exposure due to cross-contamination without a severe reaction, or may even be able to consume larger amounts without symptoms. Example, peanut OIT. Palforzia has been approved by the U.S. Food and Drug Administration (FDA) for children aged 4 to 17. Many other OIT therapies for other allergens are in clinical trial stages. 6.3.2 Epicutaneous immunotherapy. EPIT mechanism. EPIT is a newer method that uses a special patch containing allergenic proteins placed on the skin daily. The proteins are absorbed through the skin to train the immune system. Goal. Similar to OIT, EPIT aims to increase the tolerance threshold. The advantage of EPIT is that it is less invasive than OIT and may have fewer systemic side effects, although local skin reactions can occur. 6.3.3 Biologics mechanism. Biologic medications such as omalizumab Xolair are monoclonal antibodies that target specific molecules in the immune system, such as IgE antibodies. By neutralizing free IgE, this medication can reduce the body's ability to react to allergens. Applications. Omalizumab has been FDA approved for asthma and chronic idiopathic urticaria. It is also being studied for use in combination with OIT or for severe food allergy cases, with no other treatment options, helping to enhance the safety and effectiveness of immunotherapy. 6.3.4 Gut microbiome research. Potential scientists are extensively researching the role of gut bacteria microbiome in the development of the immune system and its ability to prevent or influence allergies. An imbalance in the gut microbiota dysbiosis is believed to be linked to the rise of allergic diseases. Research into fecal transplants, probiotics and prebiotics is opening new avenues for future allergy treatments and prevention methods by modulating the gut microbiota. The future of food allergy management and treatment is increasingly bright, offering hope to millions worldwide who can live safer lives, less affected by their allergies. Conclusion: the power of knowledge and action. We have just embarked on a long and detailed journey to explore the complex world of food allergies and how they can be confused with countless other health conditions. From the uncomfortable tingling itch to the dangerous moments of anaphylaxis, each symptom carries its own story, and deciphering them requires deep understanding, meticulous observation, and above all, perseverance. Remember, food allergies are not to be taken lightly. They are serious, potentially life-threatening immune reactions. Never underestimate symptoms, especially when they appear suddenly or worsen rapidly. Be a sharp observer. Document everything. Your food and symptom diary is the most powerful tool in your hands when you seek help from a healthcare professional. Trust the experts. An allergist-immunologist is your best partner in the journey of diagnosing and managing allergies. Do not believe in unscientific tests or miracle therapies not proven by medicine. Accurate diagnosis and treatment must be based on scientific evidence and expert guidance. Be prepared. If you or a loved one has a severe allergy, always carry epinephrine and an emergency action plan. Thorough preparation can be the difference between life and death in case of anaphylaxis. Ensure those around you also know how to act. Be an advocate. Raise awareness about food allergies in your community, at schools, workplaces, and in restaurants. This not only protects you, but also creates a safer and more understanding environment for everyone whose lives are affected by allergies. Knowledge is power. With the information we've shared today, we hope you are better equipped to recognize the signs, differentiate them from other illnesses, and know how to act when necessary. Your health is your most precious asset, and understanding your body is the foundation for protecting that asset. If you found this video helpful and valuable, please don't hesitate to give it a thumbs up so we know you'd like to see more similar content. Be sure to subscribe to the channel and turn on notifications so you don't miss any other important health videos from us. And most importantly, please share this video with your friends, family, or anyone you think might need this information. One share from you could help someone recognize their symptoms and seek timely help, potentially saving a life. If you have any questions or personal experiences to share about food allergies, please leave a comment below. We always want to hear from you and build a healthy community. Disclaimer: the information in this video is for educational and general informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen in this video. In a medical emergency, call 911 immediately. Thank you for watching. Take good care of your health, and we'll see you in the next video.